My name is Brian Power. I'm an advanced paramedic and I work with the Pre-Hospital Emergency Care Council as a Programme Development Officer. My first involvement with a cardiac arrest was as a 16-year-old in Waterford at a soccer match. Since then I have treated countless cardiac arrests, both here in Ireland and in the US. The sad facts in relation to cardiac arrests are that I can count on two hands the number of these patients that actually survived the event. Prior to 1983, no one survived a cardiac arrest that I had provided care for. This was after 4 years working on an emergency ambulance. I began to have severe doubts about my ability to provide care for cardiac arrests. This was despite the fact that I was an instructor in CPR both professionally and voluntarily. This left me with a huge sense of guilt. I was blaming myself for no survivors. I went to respected colleagues and medical practitioners, and they confirmed that my skills were in fact of a high standard. In 1983, the ambulance service introduced defibrillators into my station, and I got my first survivor. I actually did CPR on a cardiac arrest and defibrillated the patient and got returned to spontaneous circulation. I was ecstatic. In 2001, I was directly involved in 2 saves following the introduction of an AED program into a voluntary organisation. The organisation was on site, had the defibrillators, did the CPR, which resulted in successful outcomes. The chain of survival was intact. I qualified as an advanced paramedic here in Ireland in 2006, and since then I have been involved with a small number of cardiac arrest patients in asystole who have returned to spontaneous circulation, an absolute miracle. This is the final link in the chain of survival, advanced life support. Having been introduced for cardiac arrest patients in Ireland, I began to accept that as a practitioner, I am not to blame for the poor survival rate. It's the system, the chain of survival, or lack of it, that is the issue. As responders and practitioners, it is extremely important for your mental well-being that you do not have aspirations of saving every cardiac arrest. Your goal for cardiac arrest management has to be to perform CPR and defibrillation skills well, and not to save every patient. If the chain of survival is intact and the patient's underlying medical condition permits it, then and only then will survival of an out-of-hospital cardiac arrest be a reality. I want to thank you for your contribution to the chain of survival in Ireland by being involved in the Cardiac First Responder Programme. Thank you.